Army trucks ferrying bodies in the dead of the night has become a common scene in Bergamo, north of Italy. The local morgue is so overwhelmed that it can no longer keep up with the number of those who have died due to the coronavirus outbreak. For Chibudu Nyiro, a Kenyan master's student who has lived there for 3 years, the situation has forced him to be a prisoner in his own house.
Especially someone like me who has a housemate that we cannot interact freely because of the fear that we could infect each other just in case he goes outside to the supermarket and picks it from there, or I go outside and pick it from there. So, I mean, we have to really be careful, and to be honest, like, it's really hard.
Bergamo could be regarded as ground zero for the coronavirus outbreak in Italy. It's a wealthy region which is interconnected by road, rail and air transport with a large population of elderly people. This demographic has been hardest hit, with 31 deaths being reported in the first few weeks of March. Many others are fighting for their lives in the hospitals that are buckling under the strain of daily COVID-19 cases. The healthcare system has been brought to its knees.
Lavoriamo tutti stressatissimi con una tensione altissima.
We are working in a state of very high stress and tension. Psychological tension has gone through the roof. Unfortunately, we can't contain the situation in Lombardy. There's a high level of contagion, and we're not even counting the dead anymore.
The situation has been compared to an apocalypse. Social interaction in Bergamo and much of Italy is almost non-existent to help curb the spread of the virus that has infected 40,000 people and killed over 4,000. The mental anguish is taking its toll on many.
I miss someone patting me on my back and telling me, you are okay. And now, the only part I can get is an emoji. And it's heartbreaking. I miss home, I miss my family, I miss human contact, I miss all this. So it breaks my heart.
Chibudu can only leave his house to buy essentials and requires a special permit to move around. Since Italy is currently on lockdown, he can only spend most of his time doing school research, reading motivational books, video calling friends and family, and exercising.
I love this guy, so that's pretty much what I'm doing at the moment. I'm just doing a lot of research.
Almost 600 kilometers away in Rome, Kenyan father Raphael Ndungu, who is studying medicine and surgery, has been spending most of his time indoors because of the lockdown imposed by the Italian government. Father Ndungu has lived in Italy for 7 years, and just like many other Catholic priests in the religion's global headquarters, he has not been celebrating Mass in public due to the government's strict guidelines against public gatherings.
Since 4th of this month, I've been staying indoors because I saw it's becoming more and more problematic in the hospital, so I decided by myself to stay at home, even before they announced on 9th that nobody should leave the house.
Father Ndungu, who hails from Roiro Catholic Mission in the Archdiocese of Nairobi, is in his 5th year at the Catholic University of Sacro Cuero Polichinio Gemelli in Rome. He also has a master's degree in theology and lives 2.5 kilometers from Policlinico Agostino Gemelli Hospital, which has also witnessed a surge in cases. He hasn't left his house in 16 days.
Especially in the north where the cases started, and people started running around, and they were taking trains, their cars, traveling all over, and within a week the whole country was, and we were having cases coming up here and there.
Father Ndungu is also a member of the Congregation of Ministers of the Sick in Karen and has been in constant communication with his friends and family back home. His message is clear.
I ask fellow Kenyans, we try as much as possible to heed to the what the government is saying, and also what the health care facilities, they are trying to send an information to us that we should keep off, and we should try as much as possible to clean our hands, especially with soap and water. And also I hope that everybody is watching. You can see that in Europe we are having more problems, but unfortunately in Italy we were late, we acted late, and now we are paying the consequences.
With the situation so dire in Italy and the strained health system, the government could consider medical students such as Father Raphael Ndungu to be part of the front line to help curb the spread of the disease. The government is also considering tougher measures to restrict movement of people to help flatten the curve of rising COVID-19 cases. Bernard Ndong for Citizen TV, Nairobi.